2018. I'm also Professor of Medicine, Deputy Director of the Desmond Tutu HIV Centre at the University of Cape Town in South Africa. This press conference is being live streamed on the AIDS 2018 website, and an archived recording will be available there later. To those of you who are watching online, welcome. AIDS 2018 will feature the latest science on innovations in treatment, cure and prevention, and the latest on-the-ground strategies to address iniquities in the HIV response through nearly 3,000 abstracts presented from more than 100 countries and dozens of satellite sessions and special events. The conference will provide a powerful platform for those most affected by HIV and feature breaking science that will address the most current challenges. Together, we will hold global leaders accountable to the evidence. The end of AIDS will only come from prioritizing science-based policies and adequate funding. We are, of course, thrilled to be here in Amsterdam, the return to the Netherlands for this conference. Amsterdam previously hosted the conference in 1992, and as you will hear from our speakers, we're returning to a very different city than the one we left in 1992 at the height of its HIV epidemic. I'm pleased to say great progress has been made. Yet, next door in Eastern Europe and Central Asia, new infections have increased 30% since 2010. This conference, we believe, will also shine a spotlight on this region, the only region in the world where HIV is rapidly increasing, in large part related to injecting drug use. I am pleased to be joined today by leading voices in the global HIV response. I'd like first to introduce my co-chair for AIDS 2018, Peter Rice. Peter is Professor of Medicine at the Academic Medical Centers at the University of Amsterdam and, of course, the AIDS 2018 local chair. Peter.
Thank you very much, Linda Gale. It's a pleasure to see you all here and welcome you to Amsterdam with good weather, fortunately. As Linda Gale was saying, I mean, we are fortunate in the Netherlands to find ourselves, of course, in a country which has had a long-standing history of responding to the HIV epidemic. And I'll talk about that a little bit in the opening session. On the other hand, I think what I'll also stress is that even in a country like ours, things are not perfect, and there are things that can still be improved. One of the things, and of course it dwarfs numbers in, for instance, the Eastern European region, but still we're seeing 400 to 500 new infections, recent infections every year in our country. And we need to bring that down. And I'm very pleased, actually, that the Dutch government very recently decided to implement PrEP, which I think will be the additional tool we really need to bring the infection rate down further. At the same time, we also, and especially within people with a migration background, including in the city where we are, we find that people, when they are diagnosed, are often diagnosed much too late, with advanced infection and sometimes even AIDS, and that's, I find, really unacceptable in the era and certainly in the circumstances where we live. So it shows, and I think much of that has to do with still remaining stigma, which is, I think, a key issue still in every part of the world, but I think also still in our part of the world. I'm just making these comments because I think it's important that you'll hear a lot of people saying that it's great that Amsterdam has reached 90, but I think it's also important to stress that we're not there yet. The other thing, of course, is that bringing the conference to Amsterdam, close colleagues of mine who died on flight MH17 4 years ago were very much involved in bringing the conference to Amsterdam, and I think tonight we'll take a moment to remember them, but remember also the other people involved in the AIDS response who were on that flight, and in a way also remember, of course, everybody we've lost to AIDS, and in many parts of the world, unfortunately, are still losing to AIDS. So I think I'll stop here.
Thanks, Peter. Our next speaker is Tedros Adhanom Ghebreyesus, And as you all know, Dr. Tedros is the Director General of the World Health Organization. We've asked him to speak on any topic he wishes, but particularly also, I know, a subject close to his heart, that one of universal health care. So Dr. Tedros, please go ahead.
Thank you. So you guessed it right. I'm really obsessed with universal health coverage. I just came actually from another session, and I will tell you a story. And I would like to say good afternoon, and it's really great to be in this conference, and this is a wonderful community that I have been very close, and as you may remember, I hosted in Ethiopia when I was health minister the smaller part of IAS, which is the ICASA, and through other means I'm very, very close to this conference, and glad to be here for the first time as DG. And it's also sobering to see that despite all the remarkable advances that have been made, progress on ending AIDS is still slow. We will not meet the 2020 fast-track 90-90-90 targets because there are too many places in the world where people don't get prevention and treatment services they need, whether it's because services are not available, or because people cannot afford them, or because they are excluded from them. This is a clear signal that we need to strengthen our approaches. We need to open up and embrace new opportunities to work with others across sectors, across ministries, across programs. I have just come from a session on universal health coverage. As many of you know, WHO has just set a goal of extending universal health coverage to 1 billion more people by 2023, making sure that they get the services they need when and where they need them. Obviously, this must include services to prevent, diagnose, and treat HIV. But let me clarify, this is not just health insurance. UHC certainly means ensuring people obtain quality health services without suffering financial hardship. But it also means breaking down the barriers to access and ensuring that no one is left behind because of where they live or how they live. It means fighting stigma and discrimination so that sex workers, MSM, people who use drugs, transgender people, prisoners and refugees and migrants can access quality services and can do this free from judgment. This is still not happening, and it's unacceptable. And it means bringing HIV services into communities where they are needed as part of a broader range of health services, preventing transmission of HIV to children is vital. So too is immunizing them against polio, measles, and diphtheria. Another session I attended was at integrating HIV into sexual and reproductive health rights services. In 2018, it's alarming to see how few women and girls are able to make fundamental choices about their own reproductive health. It's imperative that communities, including women and adolescents, are consulted about their health and brought into national policy decisions that concern them. I want to end with a thank you to our many partners in civil society and my heartfelt commitment to work with all of you to reach those communities that are most vulnerable, at risk, and marginalized so that no one gets left behind. And the answer is universal health coverage. Thank you. Thank you all.
Thank you very much, Dr. Tedros. You're welcome here, and you're welcome here anytime. So thank you for being here. Our next speaker, also welcome, Quinn Tivy from the Elizabeth Taylor AIDS Foundation. Quinn is an ambassador and officer of the Elizabeth Taylor Foundation. He's also the grandson of Dame Elizabeth Taylor, who, it must be noted, attended the 8th International AIDS Conference here in Amsterdam in 1992. Quinn, over to you.
Thank you. As Linda just mentioned, in 1992, my grandmother, Elizabeth Taylor, joined the 8th International AIDS Conference here in Amsterdam. Having co-founded AMFAR and also having established her own foundation, the Elizabeth Taylor AIDS Foundation, she used her celebrity, her voice, her privilege, her access, and ultimately her activism to help focus the world on this pandemic. And she brought that determination with her here to Amsterdam. She grieved those lost, including her own friends and loved ones. She called out world leaders, including the U.S. president at the time, and she implored upon us to use her own words. The fight against AIDS is not and must never be a fight against people. It is a fight of human beings against a virus. Today, 26 years later, those words continue to ring true. It's amazing to consider how much excellent work has been done, but also important to note and to emphasize what my colleagues have been saying, that we are at risk of not reaching critical goals, which is a reminder of how hard this global community must continue to work every day. My grandmother always knew, as we know, that in addition to being a story of health, the story of HIV is a story of social justice and human rights and a need for global solidarity. With that in mind, later tonight at the opening ceremony, I will join my cousins Layla and Naomi and present the Elizabeth Taylor Human Rights Award to human rights activist Alan Acheza Meleche. It is an honor and a privilege to follow our grandmother's footsteps here in Amsterdam, carrying on her voice and her legacy and her work. We are proud to join the thousands of activists here, continuing the progress made in the years behind us, focusing on the work that must be done today and planning for tomorrow. Thank you.
Thank you, Quinn. Our next speaker then is Mercy Ngulubi of CHIVA, the Children's HIV Association. Mercy is a recipient of the Diana Legacy Award, and she will speak to her work to end stigma, and particularly the need to support young people living with HIV. Mercy, over to you.
Thank you. When I was born 20 years ago with HIV, the landscape of the epidemic looked very different to what it does now, and I can't express how grateful I am that so much has changed in that time. Yet we are still not close enough at all, as Tedros pointed out. We will not continue this way and be able to reach the 2020 target or the 2030 target. I come from a country where the last renewal of a HIV strategy was in 2001, and the one that was renewed expired in 2010. It is simply not good enough. We're not going to be able to reach these sustainable development goals without having strategies in place that pull us further towards these goals. We have to do better. The young people of this world have expectations of the leaders that sign up to these goals that these things will happen. They cannot continue to be empty promises. Young people need to be representing organizations, we need to have policies that are youth-centered, and we need to have fixed resources for youth if we continue to say that youth are the future. There needs to be a relay race of change. It's not just that youth are the future and we stand alone, but actually we stand alongside those who've brought experience and done so much work in the past few decades to really try and end this epidemic. It is so wonderful to be able to live a life where I don't have to wake up and wonder if we have the tools to fight HIV, but it is also sad to live a life where I know that we have the tools and I know that people cannot access them. Thank you.
Brilliantly said. Thank you, Mercy. Our final speaker is Yana Panfilova, founder of Teenagizer. Teenagizer is the Eurasian Union of Teenagers and Youth Living with HIV and is based in Ukraine. We're particularly pleased to have Yana with us today to share firsthand her experiences living and working in Eastern Europe and Central Asia region. Yana, over to you.
Hi everyone, my name is Yana, I'm 20 and I was born with HIV too.
Yeah, high five. When I was 16, I have founded of Eurasian Union of Adolescent and Youth Teenager. This is the only movement who work with adolescent, and they represent voices and which deal their health issue. Sorry? Oh. Okay.
Carry on.
Now we have two challenges of prevention among young people living with HIV, or young people in Eastern and Central Asia. The first challenges is access to the HIV testing. Unfortunately, not all adolescents have to access. This problem is related to age and parental contents, access to the express testing, and use-friendly services. The next problem is really big problem. I think this is not big problem in my region, but it's really problem. It's sex education. You know, many teachers don't tell about sex. There are share some responsibility for doctors. Doctors share this opportunity in for teachers. Oh, sorry, for
Yeah, no, carry on.
Yeah, families. Thank you.
Thank you.
Yeah. Also, the very important thing is that age of young people living with HIV is 10 to 11 years. Will become teenagers really soon. About half of teenagers lost one of both parents about AIDS. Grandparents take care of kids after parents. So this is really important issue. The psychological supports, and it has therapy. This is my first conference. I really want and face it as for teenagers. Young people living with HIV will be fully engaged in process of develop policies that affect them. Thank you.
Great. Thank you, and I think what I will be saying later this evening at the opening session is that this is the largest youth representation we have ever had at any AIDS conference in the past. It is also the largest number of scholarships that have gone to young people, and it is the biggest space that we have in the Global Village for young people. So Mercy and Yana, we really do want you to feel welcome. We want you to know that your voices will be heard, and please hold us accountable, because we do want to fulfill those promises we've made to you. That concludes our remarks, but we're open to hear your questions, and so I'm very happy to invite questions now to anybody on the panel. If you could just say who you are, who you represent, and who your question is directed to, and please direct the questions through me.
Thank you, Dr. Becker. It's Michael.
We need a mic here at number 2, please.
Is that any better?
That is a little bit, it's a little short, but if you don't mind stooping down.
I can kneel.
Thank you.
Dr. Becker, very quick question. Technically, you said this is the largest youth representation that the conference has ever had. Can you give us a number, and can you put that in the context of the size of the conference as a whole?
Yeah, so what I can tell you that latter, we're definitely over 15,000 people. I don't have the exact number of young people, but we tend to do those numbers during the week, and by the end of the week, we'll be able to get you those numbers for sure. I think if you could go to the mic, if you don't mind. Is that okay, just so that we hear you, because we're on live streaming? John, I think you're up at number 2.
My name is John Cohen. I'm with Science Magazine. Dr. Tedros, if I heard you correctly, you said you don't think that the 2020 targets will be met. You stipulated fast track. Do you mean that for all of the 2020 targets, just fast track? What do you think? Do you think the targets are not going to be met?
Okay. Yeah, thank you. For instance, by 2020, this is a good question, we need to have people on treatment around 30 million. And now we are around 21 million. So there is 9 million in 3 years, means 2.8 million per year. And that will be really difficult to achieve because from the rate that we have now. So that's why it will be impossible to achieve that unless we are really aggressive. I'm not saying it cannot be achieved, but we should do things differently and we need to be more aggressive, and we need to have those targets at hand, in mind, the 2.8 million, and make sure that we know the how and make it happen. So it's possible if we can be more aggressive, but it's we're really behind in achieving those targets.
Thank you. Number 2.
Can you hear me? My question, my name is Samuel Getachew from the Reporter in Ethiopia. My question is for Dr. Tedros. I want you to comment on the happenings of home between Ethiopia and Eritrea, and how is it going to affect the work of WHO, and do you plan to visit Asmara anytime soon, and when? Thank you.
Thank you. That's a very good question. By the way, we have been communicating with the Eritrean government since September to arrange a meeting, to arrange a visit. As you know, I am the Director General of WHO, so I have to visit countries, as many of them, in order to support. So based on that, I had a plan, but it didn't materialize because we couldn't get a time convenient for both of us. Otherwise, I will go anytime. And the situation between Eritrea and Ethiopia now, I think it's a model to make peace for other countries who have conflicts, similar conflicts. And I'm very, very happy that Eritrea and Ethiopia are having their peace. Eritrea and Ethiopia are actually two countries but one people. And it's really good that they're now resolving their problems politically. Political solution is important. And it's important for everything. It's important for the economy. It's important for social development, including health. Health actually is disturbed when there is no peace. You know, many of the countries who are in conflict now, the first to be really affected is the health sector. Look at Yemen or other countries who are in conflict. The health system is broke. So peace means better health system. Peace means development. So it's good for us. It's good for the other sectors too. And I commend the leaders of these two countries for really addressing their problems politically. Thank you.
Thanks, Tedros. Again, number 2, please.
Yeah. Hello, my name is Emmanuel Dubevi. I work for Ghana Business News in Accra. My question goes to Tedros. Generally, globally, there is slowness in dealing with the problem, but it's even much slower in Africa as we speak now. Prevalence rates are increasing in most countries. What is causing that, and is there any plan to address the issue immediately? Thank you.
Okay, thank you very much for that question. We have been doing our homework on this, and you know, increase in new infections or stagnation in new infections means there is weakness in health promotion and disease prevention, and meaning there is weakness in our primary health care approach. And that's why we have been saying not only universal health coverage, but strengthening the primary health care, which is the foundation of universal health coverage. And that primary health care to focus on health promotion, disease prevention, and of course the basic services that could be provided at the primary health care level. And we're ready from WHO's side, and also many other partners who believe that we need to give health promotion, disease prevention, and curative services by strengthening the primary health care, and we can address it actually at the first level, that's the prevention, and we can reduce the new cases we see. So I call upon all actually to really advocate for primary health care, not only for HIV and other communicable diseases, by the way. Primary health care and focus on health promotion, disease prevention is actually good for non-communicable diseases too. It's not only good for low-income countries or middle-income countries, but it's also good for high-income countries. Primary health care, even installing it and running it, is much cheaper, but it saves lives and it saves resources. So I think the answer is primary health care, and through that health promotion and disease prevention. And we have to really reposition all our advocacy to that in order to reduce also the rate of new infections and the prevalence. Thank you.
Thank you. Number 2.
Hi, my name is Lada, and I'm an activist from Ukraine working with HIV-positive adolescents. First, I wanted to thank you for making this youth participation possible, because I can even imagine this on other conferences. And my question is basically that, will we have the same on future conferences, or it all ends there, here? Thank you.
Well, I can certainly speak for those in which the partners involved in the International AIDS Conference are, I think it's a case of having set the bar here, there's no way we're going back. So as long as we have the resources, I think we'll be going forward. I can speak for the IAS to say that certainly is our take, and we'll continue to advocate with other HIV and AIDS conferences to do likewise. I'm not sure what influence we'll have in other health areas, but we'll also continue to work there. So thank you for raising that. Number 2.
Hi, I'm Mike Kavanaugh from HIV Hero, and my question is for Quinn. I want to thank you for being here, and everyone is extremely grateful to your grandmother for all that she's done. My question is, foundations and charities are so important in our world. What do you think the changing role in charities and how you're addressing the communities you serve in the last couple of years, and what should charities be doing more instead of just raising funds?
I think a key, is this okay? I think a key part of, is this all right? Yeah. All right. Thanks. Sorry about that. I think a key part of the answer lies in your question, which is the communities that they serve. So integrating with, working with, respecting, serving, communicating with those communities is such a critical part, I think, of any type of work in that capacity. And I think also that there is a great responsibility that falls on those private foundations in some cases where public opportunities may fall short. And so there's a balance between the public need, the private need, and how all of these different areas can best serve various locations, various communities, various groups of people.
Thank you.
Hello, I'm Heather Berner from Medscape. Dr. Tedros, this morning at the session on the ECHO trial, Dr. Helen Reese called for us to really stop talking about integrating sexual and reproductive health care with HIV and actually start creating an index for integrating them. And she called specifically for the World Health Organization to work with AVAC and FP 2020 to create an index along those lines. And I wanted to ask your comment on that and whether World Health Organization would be willing to be part of that.
Yeah, thank you so much. On SRHR integrating it, there is no question, and we have been actually preparing for this, not only the talking part. And then our intention is to partner with all stakeholders that could make contributions based on their comparative advantage. And what's important now is to go to the ground to make it happen. And we are at WHO in the process of selecting some countries and start it quickly. And we have already selected around 10 countries, and we will phase by phase move into additional countries. Thank you.
Thank you.
Hi, thanks. My name is Mariette Leroux. I'm a journalist with the Agence France-Presse. A lot of experts in the days leading up to this conference have been warning of resurgence of the epidemic. And some have even talked about things going back perhaps to what they were like in the 80s and 90s. So my question is this just pure rhetoric? Is it scaremongering perhaps to try and draw some attention and money back to the cause? Or is this a real concern, and if so, what is it based on? Thank you.
So I'm going to ask Peter perhaps to take a first stab at that, Peter, if you'd like
I couldn't
So
grasp the question very well.
The question was that it has been stated that we are stalled and we may actually be regressing. People have even said we'd go as far back as the beginning of the epidemic in terms of stagnation. Is that true, or is it just, the glass is half empty? What do you think?
Well, my perspective is that there's no one single answer to this. I mean, I think it's very well shown actually in the last UNAIDS global report that places in the world differ, and there are actually places, increasingly places, where things go well and where the targets are met. But as you go along and you look in a more detailed way, you'll also discover places where it's going less well, even within the same country. I think that's actually helpful because it helps you focus your response more. So I think increasingly that's how the world will need to look at it. And I think a slogan that was out a few years ago, "Know Your Epidemic," I think is very, very important. You really need to have the data and monitor your epidemic in a situation where you work and where you live, and adjust your responses accordingly would be my general answer to that.
Thanks.
Thank you. My name is Jan Hertblands from the Netherlands, Dutch journalist. My question is actually to Peter Rice.
Speak up a little bit because I have trouble hearing.
Okay. Thank you.
That works for me.
With respect to all of you in the forum, I'm a bit surprised that issues like vaccine and cure are not being talked about at this first meeting of this important conference.
So Peter, will you pick up on that?
Yeah. Okay. I think the topics, both of the topics that you mentioned, are, I think, very important and important topics of research. And I think, especially talking about cure, maybe slightly more than for vaccines, it is actually a very important focus of the basic and translational science sessions at this conference, where strong abstracts have been put in, and the committees have really been able to build strong tracks, which has not always been the case at the International AIDS Conference, but I think it's quite exceptional, the quality of those tracks. So cure will be discussed. I think the issue with cure is I'm giving my personal opinion, it's not around the corner. So what needs to be done while we are waiting for a cure is much of what we've discussed in the press conference so far. At the same time, I would say it's essential that research continues, and I think it's even possibly more essential that research continues into finding a vaccine, which ultimately needs to be part of the solution. And although there's not that many results being presented on vaccines at this conference, I mean, things take time, and then Miguel knows better than I, there's a lot of work going on, there are a number of clinical trials going on, and we'll have to wait for the results, and unfortunately don't have them yet here. But I think, so you need to make your choices, what you discuss at a press conference, but I think if your question is it important that we continue talking about cure and vaccine, 100% yes.
And on Wednesday, we'll focus a lot more on the sort of intimate details of the science being presented in that regard. So please feel free to turn up on Wednesday. Over to you.
Yeah, hi, Jeff Barry, Positively Aware Magazine. This question is for Dr. Becker or Dr. Rees, or actually anyone on the panel who would like to comment. I'm sure you're aware of the call for AIDS 2020 to be moved from San Francisco and Oakland due to the travel bans and the human rights violations and the volatile situation, and it's going to be an election year, right, and months before the election, and I wondered if you care to comment.
Yeah, I'm happy to field that question as the current president of the International AIDS Society. That is the choice that has been made in a democratically sort of motivated way. We have heard the voice of community. We're working very closely with that community to really hear those voices and respond appropriately. I think there is also great value in interacting with communities, and we've never shied away from controversy in terms of political machinations. I think Dr. Tedros said it beautifully. Politics has a direct impact on our response, on our ability to move. But as a field, as a response, we have never, not taken that controversy on. But I will say to you that we are obviously not oblivious of communities' thoughts about this. Whilst it's the conference is targeted to San Francisco, it also involves Oakland. And it is an opportunity to highlight inequities, even in a first world developed scenario. And I think those opportunities may be also very important for interrogating. So our focus at the moment is on AIDS 2018, and rightly so. We're in a wonderful part of the world where I think we can learn a great deal, and we'll be working for the next couple of years on the next, and making sure that that messaging is very straight. So thank you for your question, and happy to talk more. Last, I think, how are we doing for time? We're okay?
My question actually is for, well, any member of the panel can answer it. I attended one of the pre-conferences, and it was about transgender. And one of the speakers was really concerned that they're not fully represented at the advisory level when we talk about HIV and AIDS, that no one talks for them. They find it difficult to talk about their issues. They find it difficult to be fully represented. And, well, it's two in one, actually. And the second is looking ahead into Target 1990. We know that in Africa and some other parts of the world, transgender issues are very controversial. Now, if we're to look at that target, how are we going to put the campaign forward to be able to achieve the target? Thank you.
Thank you, and I'll thank you for raising that important topic. I'm going to ask if there's anyone in the panel who wants to take it on. I'll start. Well, maybe Peter will follow me, but I think it has been said by John Cohen and others that have we lost that in the 10-10-10 of the 90-90-90? And I think the other very important slogan that goes with 90-90-90 is leave no one behind. And I'm hoping that this conference does shine a light on the populations who are perhaps the most vulnerable to HIV and yet are the most underserved. And there is no doubt that transgender people easily fall into that category, not only in Africa but throughout the world. So I think your concern is a well-raised one. I'm not sure what the answer is to ensure that that sector of our community is better represented. I think we will continue to strive to make sure that is the case, as we should with every particular group. I think we do want to move to patient-centered, tailored, client-centered approaches to prevention, treatment, and care. And we're working hard to find ways to do that more effectively. But Peter, I don't know if you want to add anything.
No, maybe I agree totally. Maybe just to add that looking at the conference program, I think the committees have made an effort to make transgender issues visible. You'll see some of that in the opening session later. But there are important lessons to be learned from parts of the world where people have successfully embarked on programs for transgender people, such as, for instance, a country like Thailand that will have sessions at this conference to share their experiences.
Thank you. Okay, this one is the last one.
Voy a hablar en español, no sé si alguien me puede traducir, el colega de El Salvador, tal vez. Bueno, voy a hablar en español como una performance también del habla para romper el colonialismo del idioma que se impone en las conferencias internacionales, que es el inglés. Y la pregunta es para los organizadores, junto con felicitarlos, por supuesto, y agradecer la invitación que se le ha hecho a los periodistas comunitarios de América Latina que hablamos español, preguntarles si esos periodistas y si además los activistas que venimos de América Latina vamos a tener la oportunidad de seguir las conferencias, de dialogar con los expertos, con los activistas, con los científicos en nuestra propia lengua, que es el español, u otras lenguas que no son el inglés.
The question was in Spanish for Victor Hugo Robles from El Desconcierto from Chile, known as the Che of the Gays in Latin America. And he's speaking Spanish because he's trying to give the message that all the Spanish people here have been struggling to ask questions and have interviews with everyone of you because no one speaks Spanish here. So it's an intent to give a message to get more easier for the journalists and for the people who are attending here to have more access to content in Spanish and could speak with you. Thank you.
I couldn't agree more. Thank you very much. I think this continues to be an ongoing conundrum for us who put these conferences on. What I can tell you is I'm delighted that because we really wanted to have Eastern Europe and Central Asia as much involved as possible, we have been able to get Russian translation everywhere we could. This significantly pushes up the cost of conferences, but we recognize this is an ongoing problem and we welcome good ideas of how to solve this in the future. And with that, I think we want to thank you all very much indeed for being here today, and very much to the panel. Thank you for your great ideas and input. And we look forward to also seeing you at the opening session in a few minutes.
And we just ask that everybody remain seated so that these speakers can get down to the opening ceremony. Wait and let the speakers actually